Hi, I'm Dr. Sebastian Gonzalez, and today we're going to be talking about calf strains. I'm just going to give you a little bit of insight on what a calf strain is, who it occurs with, why it occurs, what happens within it, and what you can do about it. You ever been running along on the trail and just feel something tighten up in your calf? Doesn't seem like anything really caused it. There's nothing really that fell on you. No one kicked you. This is very characteristic of a calf strain. Calf strains can really happen anywhere within the muscle of the calf, and we're talking about any muscle within the calf as well. So there can be the superficial ones, the ones you really see the gastrocnemius and the soleus, or the deeper ones, the deep posterior compartment, which is some other muscle groups that can also get strains as well. The main spot where you can have a calf strain is usually within here, right before it becomes the Achilles tendon. Like I said, it's very common within runners, but also can happen with any other type of athlete as well. It's not nailed down just to endurance athletes. There's a couple different ways calf strains can happen. The most common is overuse, overtraining, overstretching, doing too much of something really. The second way is trauma or crushing, anything like that. What really happens within that is there's small tears usually that occur in most cases. They're called micro tears that actually occur within the muscle or in the muscle fibers that causes the muscle to become in spasm, which stops you from running or performing completely. Obviously there's different types of tears. There's complete ones, non-complete ones, and there's micro. Most commonly these are micro tears. The thing you have to understand about micro tears is the body, and this is the reason why it'll get better pretty quickly and then it'll happen again a couple weeks or a month later, is that the body fills it usually with scar tissues. The scar tissue is really more fibrotic and less pliable than most normal tissue. The reason why that keeps popping up and keeps having re-injury is because this area keeps tearing and healing and tearing and healing. It's a repetitive cycle. It's called repetitive trauma disorder or repetitive stress injury. So, like I said, usually small tears happen, the healing occurs, re-tearing occurs as well. Some different treatment options out there are, number one is rest, ice, compression, elevate, which is RICE. This is the most common type, and this is the thing you should usually do, especially when it's fresh. Ultrasound, electrical stimulation. There's taping techniques that can also help out a little bit with this, heating and whatnot. Muscle work, I think, is the best thing that I've found. The thing about these areas of scarring is that they don't respond really well to stretching because usually the other muscles surrounding that one little focal spot stretches much better and faster than that one little spot. So sometimes you need someone to actually go in there manually to find that spot, dig their thumb or their finger or something in there and really break it up. Different ways you can do this is, there's deep tissue massage, there's Graston technique, there's active release. But the thing is, though, and this is what a lot of people miss, is even though you have the area that you fix and you break that scar tissue out, you have to re-strengthen it. And also you have to consider what caused the thing in the first place. Why did it happen on that right calf and not the left? So a lot of times there's things such as video gait analysis, which is very critical in finding out why this happened in the first place. So we'll break that tissue out, we will re-strengthen it, and then we'll find out what's going on and why did the calf strain in the first place. I think it's a very systematic approach to solving these problems, and I think that most anyone, would respond very quickly to this type of treatment.